This research was completed for the Inner South Community Health Service in context of their Social and Health Inclusion Port, or SHIP initiative, a health promotion project focused on supporting health and wellbeing for the Port Melbourne community. Assessing need in Port Melbourne identified food access as a barrier to healthy eating. This report aims to investigate food security to inform future planning and strategies of the SHIP initiative to assist in meeting its goal of healthy eating for all and assist residents to have access to adequate healthy food. We discovered a plethora of available resources to assist food access and healthy eating on a budget for this community. The project also provided the opportunity to collate and update these and develop further resources as a toolkit for the nutrition clinic at Inner South.
Recent census data shows that overall Port Melbourne is more socio-economically advantaged than the rest of the state, with a high average income and education level. It also has a high proportion of residents living in social housing than the rest of the state, and approximately 16% of residents are from low-income households. This shows that socio-economic disadvantage is still a reality for some residents, despite Port Melbourne's overall affluence. It was also noted that 20% of residents spoke a language other than English at home, suggesting that linguistic diversity should be considered in the development of future programs and strategies. We also consulted the Health Promotion Coordinator and dietitians at Inner South, looked at the Port Melbourne Community Survey, the Inner South Community Health Service Needs Assessment and Community Concerns, and identified the key factors affecting food security are population growth and gentrification, geographical isolation, limited transport options, and lack of diversity of supermarkets and grocery stores. This background research revealed 3 key areas requiring further research: food affordability, food availability, and physical access to food.
Food affordability was assessed across the 5 appropriate supermarkets and grocery stores in Port Melbourne, in consultation with Monash University and using the Winter Victorian Healthy Food Basket Survey, a list of 44 foods to represent a healthy fortnightly grocery list. All stores were posted a statement of information ensuring confidentiality of information before pricing was obtained for the list of foods. The cost of the food basket for each store was averaged to determine the cost of healthy eating in Port Melbourne for each of the 4 families. This was compared to the average Victorian food basket cost and the income brackets for Port Melbourne residents to determine affordability. These comparisons highlighted that the cost of healthy eating is on average approximately 39% more expensive in Port Melbourne than in Victoria, and for low-income families with children, healthy eating is likely unaffordable at 30 to 50% of their fortnightly income.
To determine food availability, the number and variety of supermarkets and grocery stores in Port Melbourne was compared with other areas in the city of Port Phillip, finding that there are fewer supermarkets and grocery stores per area in Port Melbourne compared with the average for the municipality. There are also limited alternatives to supermarkets within the suburb, with no discount food chains, few specialty food stores, and no markets. Availability of food was also determined by the number of items on the Healthy Food Basket survey that were available at each store. This found that there are some limitations to food availability depending on where you shop. Only one supermarket had all items available, and more than 20% of items were unavailable at one store. Food accessibility was determined by public and community transport options that provide walking distance access to the supermarkets and grocery stores for the 12% of Port Melbourne residents who don't own a car. A number of public transport options, as well as free community transport, help residents to access food both within and outside of the suburb. However, some areas of Port Melbourne are poorly serviced by public transport. This, combined with the centralisation of supermarkets and grocery stores to one specific area in the suburb, makes food access difficult for people who do not live within walking distance to the shops or public transport and do not own a car.
Recommendations were developed to inform the SHIP Community Committee of findings on food affordability and access in Port Melbourne. These were detailed in the accompanying report and allocated into 4 areas. Town planning and infrastructure recommendations aim to advocate for food outlet and public transport development that also considers the Fisherman's Bend Renewal Project. Stakeholder engagement and partnership development plan to consider home delivery services, redistribution of surplus foods, and expanding subsidised meal programs with local government organisations and businesses. Community and council-based initiatives plan to increase awareness of and grow community gardens and markets, extend existing community bus services, research consumption patterns, continue the Victorian Healthy Food Basket survey, and consider cultural diversity. Education and capacity building plan to increase community awareness of existing services, develop a budget-focused toolkit of written resources and a skills-based nutrition education program, and promote existing state and national nutrition education campaigns. The findings of the report were disseminated at the SHIP Working Committee meeting involving stakeholders from local council, residents and dietitians, and the Health Promotion Coordinator from Inner South. The final report and resources were provided to Inner South and the SHIP Health Promotion team and were planned to be distributed to clients via dietitians, case managers, and made available on the external Inner South website. For more information on the SHIP initiative, for the accompanying report and toolkit of resources, see the Inner South Community Health Service website.